I am Felice. I am an inflammatory bowel disease specialist at the University of Cincinnati. And today I'm going to talk to you about the small molecules called JAK inhibitors that have been approved for the treatment of moderate to severe ulcerative colitis. This class of medications are oral medications that work rapidly and have a lack of immunogenicity, meaning that your body does not form any antibodies. They modulate the inflammatory pathway by blocking one or more JAK receptors and therefore decreasing inflammation in your gut. They've been on the market for rheumatoid arthritis, and they're currently approved for moderate to severe ulcerative colitis after you failed a medication such as an anti-TNF medication, adalimumab, which is Humira, and infliximab, which is Remicade. So there's two classes of drugs that's on the market right now for ulcerative colitis. One is called tofacitinib, brand name is Xeljanz, and the other is upadacitinib, also called Rinvoq. Let's talk about tofacitinib first. So tofacitinib is given as a twice-a-day dose for the first 8 weeks. Then your physician can decide whether they keep you on a high or a lower dose, and they can switch you at that point to a once-a-day dose. Upadacitinib starts off with a once-a-day tablet, and also after 8 weeks, your physician can decide what they keep you on a higher dose or a lower dose, depending on how you're responding to this medication. When we think about this class of medications, we have to consider safety. You are at increased risk for infections, specifically zoster, which is also called shingles. And so we strongly recommend that you get the shingles vaccine that's available at your local pharmacy. On blood work, you will also find that your cholesterol may increase over time, but it's both your good and your bad cholesterol. So your physician will check your cholesterol levels before and at least one time after you start the medication. Like many other IBD medications, you are at increased risk for skin cancer, and we recommend that you see a yearly dermatologist. Some patients may also be at increased risk for forming blood clots, and this could be in your legs or in your lungs. We saw some of this happening to some of the rheumatoid arthritis patients, and therefore your physician will monitor you closely. Currently, we don't have any safety data for you to use this medication during pregnancy or breastfeeding. And so we currently do not recommend that you stay on this medication during those times. So in summary, currently we have two JAK inhibitors, tofacitinib, which is called Xeljanz, and upadacitinib, which is called Rinvoq, that's on the market for moderate to severe ulcerative colitis. They're oral medications that are taken once a day during maintenance therapy. They work fast, and your body does not form any antibodies against them. Thank you so much.